All right, good morning, good afternoon, good evening from wherever you're joining us from across the world. I'm Victoria Rubadiri. This is FPNN, the second edition.
And it happens to be the third day of this conversation from Pattaya in Thailand. I'm Andrew Chamagiro from Uganda with my lovely sister from Kenya here. The East Africans at the core of this. And not only that, the conversation that is going yesterday, I had time to listen to our colleagues from the Latin America. Then we had the guys from the Asia. The conversation is very vibrant. How was your night?
Oh my goodness, it was full of research, contacting, of course, partners back at home. But I mean, I was also trying to take in the day that was yesterday. Of course, it was our first broadcast here on FPNN. And of course, trying to get the conversations and understand what was going on. We spoke to Dr. Kanam, of course, of UNFPA, and just some of the commitments coming out of that conversation. I think also what is super exciting are the monetary commitments coming from different governments and partners towards family planning. So that's been really exciting.
Wow, was very exciting. Yesterday we had the red carpet event. I attended.
Wonderful.
Yesterday we had the FP 2030 commitments. I attended. The party that was there. Oh Lord, you should have been there.
You still have the energy from last night.
I really want to thank everyone who turned up for the red carpet event and those who turned up for the FP 2030.
Yeah.
Yo!
We have some people
that
in the room.
was super great. And tonight, maybe I could take you along and you see what is going on. But for me, the excitement was the commitments, individual commitments, institutional commitments, and government commitments, but notwithstanding the youth engagement, the different layers. We really want to thank the youth across the continents that are part of the conversation virtually and those who are here. And this morning, we went to a couple of sessions. I attended the male engagement.
How was that?
It was exciting. I learned from a place called Lao. They have a motto that is including the men from the school model to the adult age and the young adult. So the conversations are really much more remarkable here. The conversations are just still going. And I don't know whether we can actually see. Okay, to those of you who didn't see what happened yesterday, let's take a look in video form of what transpired yesterday on our day 2 of the FPNN, and then we can be in position to bring you fast forward to today.
Hello everyone, we hope you tuned in into the second day of the ICFP Conference 2022. Today we focused on family planning and universal health coverage. We also had the opportunity to learn from government sector, the private sector, philanthropic organizations, and individual experts from around the world. We cannot forget about the red carpet event, which is a special celebration featuring performers and honorees for the exemplary work in family planning and reproductive health. Please remain tuned into our program and do not forget to hashtag ICFP 2022, hashtag FP for all, and hashtag FPNN in your socials.
Wow, what a night. And you know, not just a night, what a last couple of days here at ICFP. ICFP. It's been amazing. The only way I can describe it in terms of engagement is a circus
Yeah,
of
true.
engagement. There's
True.
so much happening, so much going on. We are actually in the center of the exhibition hall.
Yeah.
So a lot of groups, of course, showcasing the work that they're doing in the family planning space. Speaking of which, we're just about to get into a conversation with the Guttmacher Institute, and they came up with a very innovative tool, which basically helps donors track their money to see how it's being spent, who it impacts, and the numbers show that impact.
I love this.
So we're about to get into that, of course, and what drove that initiative and how it's going to be a game changer in the donor space.
I think I love that because the conversations here are about innovate, collaborate, and making sure that everyone is part of this. So this innovation and the fact that it's a data-based kind of innovation that shows you that if you invest this much money in this particular campaign or project, this is how far the impact can be. We're having that conversation very soon, and we just can't wait to have Elizabeth Sally, who happens to be a representative from Guttmacher, and Anna Popinchuk from still Guttmacher. We're having them in a bit.
That's right. And of course, as we await that conversation, I have to make mention of this, Andrew. Yesterday, I sat in for the press conference on the Ouagadougou partnership. And this is a transformative initiative started back in 2011. 9 West African Francophone countries came together to find a way of ramping up their work in family planning and funding as well. So what is interesting, when you look at just how funding is fielded to different countries across Africa, the Anglophone African countries attract more funding.
Oh.
That's right. When you look at our Francophone counterparts, they get a fraction of what the Anglophone countries get. But they've managed to do some amazing work. And let me take you through some of the work that they've done. So these countries include Benin, Burkina Faso, Cameroon, Cote d'Ivoire, Guinea, Mali, Mauritania, Niger, Senegal, and Togo. So over the last 10 years or so, they've managed to avert over 18 million unintended pregnancies, 6.6 million unsafe abortions, and 63,000 maternal deaths. So it's been amazing in terms of them coming together. And that consolidation has attracted funding. Because they've seen, of course, the difference that they've made. And they have an ambitious goal to reach, wait for it, 13 million users of contraceptives by 2030. Right now, they're at 6.5 million. So that's doubling that number by 2030.
Well done, the Francophone
so they're doing
brothers
amazing
and
work
sisters.
at the Ouagadougou partnership.
Did you learn how they say thank you? Like, well done in the Francophone?
How do they say well done?
Oh, come on. But well done. Let's clap for the Francophone team. Well done. That is very amazing. We're sure you're actually following this conversation. I had the youth who was there, who was very much at the center, the young guy who was wearing a jacket. I picked a little bit of that conversation, but I love the crowd pooling and making sure that the conversation of funding to financing, it seems to them, with the meager resources, they're getting huge impact.
And this is another thing. When you look at the executive director who runs it, Marie Ban, and she said this morning during another conversation, one thing they've managed to do is also localize research. And this is driven by civil society and youth groups because they know the need.
Of course.
They understand what it is they need in terms of funding. And when you kind of flip it that way, it's shifting the power back into their hands for them to say, look, this is what we need. These are the programs that require this kind of funding. And it's been an extreme game changer for them in terms of course, advocating for support. So just seeing how they've shifted the power in their favor just by taking the agency back, it's been amazing. Yeah.
This is the kind of conversation we need when we're dealing with advocacy. And without any further ado, friends, that kind of innovation when it gets to investments, especially the donors and the investors in the family planning space. Let's get ready to have an interview with Elizabeth Sally and Anna Popinchuk from Guttmacher, and then we'll be back shortly. But for now, let's get ready for that interview. We'll be back in a bit. morning.
Good morning.
How do you feel?
Good. Great to be here.
So who is Elizabeth?
I'm Elizabeth.
You're Elizabeth.
Yes.
Joe Poppin Chuck.
Pop and Chalk. You got it
Poppin'
right.
Good to see you. So let's talk about this competition. Both your scientists, correct?
Yes.
Let's talk about why this kind of innovation. I'll start with you, Poppin Chuck. What triggered this kind of innovation for starters?
Yeah, that's a great question. So, the Guttmacher Institute has a long history of estimating global and regional evidence on sexual and reproductive health and rights. But we've always wanted to figure out how we can have more country level evidence, and more importantly, put evidence in the hands of the stakeholders who can really use it at their country level. And so, drawing from a tool a study that we had before called the Adding It Up study, we wanted to use that methodology to develop this calculator so that stakeholders could use it and calculate the impacts of investing in family planning.
So that was it.
Well, and I think like we talk about like investments in family planning and we talk about dollar amounts, but I think like translating like what does $10 million mean? What does that actually mean in terms of the impact on the lives of women and girls? And so we wanted to take a calculator and say, okay, if you're making a $10 million investment in this country, like these are the number of modern method users that can be served. These are the unintended pregnancies that you can avert. These are the lives that are saved. And we also show the cost savings. So we sort of say like, it's not just that this is like an impactful investment, but it's actually a cost savings one. So when you invest $1 in family planning, when you allow people to prevent pregnancies they don't want, they don't come to the health system needing maternal and newborn health care services. You save your healthcare system money when you allow people the preventative services. Family planning is a preventative service when you let them have the access to that. And so this is really, it's a tool for advocates to make that case and to really get that powerful message out into their countries and for donor countries as well, to really show to their populations, this is the value of the money that we're putting in.
Wow.
You know,
Very amazing.
No, absolutely. Anna, I just want to bring you in here because we've heard about this specific data that you provide through the tool. But how much do donors actually save as a result of using this particular tool?
So that's what's really great about this tool is that it's customizable. So people can go in and say this. So say we have $1 million from this donor. Let's see what the impacts are. And so you're able to really quantify what the impact of that funding will be in terms of lives saved and as Beth was saying, the savings to the healthcare system. And so this tool we launched in September. And so we're really excited to get it out in the world. And we want to work with advocates to figure out how can we keep spreading those messages and how can we help show donors why this is such a cost-effective investment.
So Elizabeth, it's still pretty nascent in the market, but have you gotten feedback from anyone who's used it even in the initial stages?
Yeah.
So we have like great usage statistics in the first month, which was exciting to see. So I think what we're hearing is it's meeting a demand. It's also mobile friendly. So people have been saying like, I don't need a desktop application. I don't need something like I can do it on my phone. I can be in front of a minister of finance and I can show them this, right? And I think that matters. So I think we're hearing a lot of excitement, but we have great case studies from the past. So we did reports on the impact of investments the Canadian government had made in family planning and the UK government. And those have been really successfully used by advocates already. And I think it was seeing that success where we thought, hey, like, we don't need to do like reports that take us a while to do. People can just have this data in their own hands. It doesn't need to be like, sometimes we take so long, especially as scientists. We like to publish, we take a long time to get data out there. And I think we're really trying to say, like, we don't need to hold the data. Like, everyone should be able to hold this data themselves and use it. That we shouldn't, like, there's power in who holds data, and we need to distribute data like we need to distribute power.
Absolutely. And it also brings in that accountability element that oftentimes is missing in the donor space. How much of a game changer is that as well?
Yeah, I think it's a really big game changer. And I hope that, how wonderful to be able to be in a meeting and say, oh, I can just pull this up on my phone. And here, let me show you this graphic that visually shows you the impact of your investment. It really drives home the message. And I think visuals are really important. And so are being able to customize the evidence that you want to be bringing to your conversation.
And I think
when we look at the kind of currencies we're covering, how many currencies does the calculator carry? Is it on in dollars? Is it on in euros, yens, and pounds, or it covers shillings?
All currencies.
All
currencies are included. We use an API, and so it actually updates the every day. So sometimes that can be why the results look a little bit different, but it's really exciting to be able to build an online tool that can be so customizable and interactive in that way and ensures that people can use it in whatever currency they need.
And I think part of it too is, family planning financing doesn't just come in dollars, it doesn't just come in euros, and it doesn't just come in pounds. And it's countries should be advocating for their own budgets, for advocates to say, in my country, I want my government to know that this is a service that we as a population deserve access to, and we need to put our money there. And I think thinking about domestic financing, and we shouldn't be talking in US dollars about domestic financing. We should be talking about the currencies that matter in the ministries of finance where that conversation is taking place.
Yeah.
Okay. To those watching this conversation, possibly what we're talking to you seems to be some kind of alien conversation. Let's have a look at this video on the screen, and possibly you'll make sense of what kind of calculator we're talking about when we look at the donor funding and the impact, how far it can go to the very last mile if we're to track the family planning funding.
This video will walk you through how to use the calculator. Let's begin by clicking on the orange Get Started button. The first step is defining your investment inputs. First, select a currency for the investment from the drop-down menu here. Please note that the currency of investment must be the same for all recipient countries, subregions, or regions you plan on selecting. Next, select the country, subregion, or region where this funding is being spent. You can choose as many recipients as you'd like, but you will need to enter each recipient into the calculator separately and indicate how much funding each would receive. The calculator will generate a table listing the impacts for each recipient. To generate additional graphics focusing on each impact, you must run the calculator for just one recipient at a time. Finally, enter your investment amount. This amount should represent 1 year of funding to be applied to the full cost of family planning services in your recipient country or region. Once you've entered everything, click Add, and a summary of your inputs will appear at the bottom of the screen. If you plan on adding additional investments, repeat the same process. Or if your investment has been entered incorrectly, you can click the trash icon to start over. If you are finished adding investments, click the Next button. Next, you will select your output preferences for your table and/or graphics. This includes selecting the language and currency for your results. You also have the opportunity to provide a funder or investor name if you wish. When you've entered all your information, press Calculate to get your estimates. And here we have all the outputs generated by the calculator. First is a summary table that can be downloaded as a CSV by clicking here. The summary table is always generated regardless of whether you enter one or many recipients. If you scroll down, there are 7 different graphics listing the cost savings and specific health benefits from investing in family planning. These graphics can be downloaded to be used for presentations, social media, or reports by clicking the Download PNG button. Graphics are produced if only one recipient is selected. We look forward to hearing how you use the Family Planning Investment Impact Calculator. For additional information, you can refer to the frequently asked questions, which includes a detailed description of the methodology. If you have any questions or issues, please contact us at fpiic@guttmacher.org.
Wow, incredible. When you're looking at, and there's something really important that you said, Elizabeth, that, money doesn't just come in dollars, from the donors. It also comes in the form of domestic financing. And that is coming at a time when we're seeing that shift and transition from funding to domestic financing. So just talk a bit more about how important that agency is for local governments to make those kinds of decisions.
Yeah, I think what we fund is what we prioritize.
Yeah.
And I think what we're saying is if family planning is a priority, and many governments have made that clear, they've made commitments, they've made FP 2030 commitments, they've said family planning is a priority. And I think we need to say, okay, you also need to put money to show that that is a priority. And I think populations need to see that that's how you get real commitment. It's easy to pay lip service, right? We know that. But when you put your money where your mouth is, it shows that you really truly value it. And I think with family planning, we're showing that we know we value it, the impacts are large, and it's a smart investment. That's what we keep saying. Like it's not just a rights-based, meaningful, life-changing investment that can transform societies. It's also smart financially, and it's all of those things together.
Certainly.
This could be my very last question. Donors and investors, when it gets to family planning, they need the heft of the data. How safe is it that the data cannot be duplicated or messed up with to meet the need of whoever wants to?
You say, can you say that one more time?
Can anyone manipulate the data?
In the calculator?
Yeah.
No, it can't. I mean, all the data that's behind it is actually open. It's up and available on Open Science Framework. So it's all open and accessible data. So people can go and see how we got those estimates. They can sort of follow the methods, and we've got a long methodology report as well. But you can't go in and change the inputs that are there. So someone couldn't make family planning look like less of a good investment. And I think that's critical, right? I think we need to make data open, but we also need to make sure people trust the evidence, and that's really important.
Thank you. Ladies and gentlemen, round of applause to Popkin Chuck and Elizabeth Sally.
Thank you so much.
Thank you guys so much. We
Fantastic.
appreciate you
Yeah,
showing
thank
this.
you so much for having us.
Thank you. Enjoy the rest of the conference. Wonderful.
Well done. Thank you so much. Let's clap for them. Come on, people. Let's show them some love.
Wow. So in just a few minutes, we'll be heading back to another conversation on the commitments been made over the last couple of days. And we'll be joined, of course, by the FP 2030 Executive Director and representative from WHO.
Absolutely. That is going to be remarkable. To those who attended yesterday, the FPN 2030 conversation, Dr. Dubé is going to be right here. And we're going to look at the spatial commitments you made and the institutional commitments that were made in the juxtaposition of the World Health Organization conversation.
Wonderful. Let's take a look at a few messages.
Yeah. Dr. Dube. Jumbo. Finally. All right, welcome again to another great conversation. I told you those who just attended last night, it went titanium in a great way. My, oh my, if you were there, just clap for yesterday night. The FP20 commitments. Lord, oh Lord, I can feel my legs a little bit, but it was very exciting. Tell you what, in that entire room while we were there, Vicky, I wish you were there.
Yeah.
What happened there is like we saw people from the high level, the global scale, all getting down and excited about what this commitment is. And the one who was at the core is Dr. Sam Kaliso Dube, the executive director of the FP 2030. To those of you who are not aware what she has done for the last 20 years or so, she has been in the healthcare and included some senior roles in the delivery and financing of healthcare. She comes from Afrocentric Health, where she worked as a general manager, leading health policy and medical advisory, worked at the Royal Philips as medical counsel for Africa, business development manager in Southern Africa. And last night, she was the lead dancer for the FP 2030 commitments. Good to see you, Dr. Dube. Hey, Ujambo.
Fantastic. And we're not just with Dr. Samu, we're here with Professor Pascal Alotain, and she's the Director, Department of Sexual and Reproductive Health, including UNDP, UNFPA, UNICEF, WHO, World Bank Special Program for Research and Training. Take that all in. All right. But there's more. So she's a leader in gender, in equity, health, human rights, with over 3 decades of experience as a global public health researcher. Her recent work includes challenging the boundaries of global health, advocating for accountability in the decolonization of global health and international development, and expanding opportunities to diversify the voices of contributors to global debates and decision-making. And beyond that, she's a triple certified nurse, a midwife, and public health nurse. So she's been practicing this as well. She's not just been talking as well. So welcome once again to you, Professor Pascal. Thank you so much. But let's get into these commitments and why they're so important. I'll begin with you, Dr. Samu. This began with FP 2020. We're now at FP 2030. Where's the change? Where's the difference? What will this commitment mean?
Thank you. And good afternoon, ladies and gentlemen. I hope you're enjoying the conference. So we started our journey in 2012 at the London Summit, where FP 2020 then was born. And our mandate was to 69 countries. But now FP 2030 is making commitments to everyone, getting commitments from everyone, whether it's private sector, government, bilateral institutions like WHO, making commitments to how we're going to increase access to family planning services, commodities, information across the globe. That for me is a fundamental step of where we are. A commitment, as I said earlier on, is a promise. It's that statement of intentionality. I'm intentional in making this thing work as an individual, as an organization, or as a country. So that's why commitments are important. For us with WHO, they foster not only partnership, because we know the technical expertise that WHO has in terms of offering technical assistance, research and innovation, where actually Pascal is, technical guidelines we get from her department, assistance programs, etc. But more importantly, because as FP 2030, we are the only global organization that convenes dialogue solely focused on family planning. So our focus, razor sharp, is on family planning. And because we convene power, hopefully convening money, and money will come, we convene dialogue, and those important conversations that are not said about family planning, we need commitment makers to say, we will stay true to this promise and we'll follow through in an accountability framework and rights-based mechanism, so that as a movement, we can achieve a world where women and girls have got choice, they've got access to when and whether they want to have children, and be active participants in the countries where they belong, especially in economies. So that's what we believe and why these commitments are important.
Dr. Pascal, if I may engage there, you two global women seated here having this conversation. How does the global perspective and all the commitments you have translate to the local conversations, to the very last mile in the little villages where we come from across the globe?
I'll start. Thank you very much for that. I'll start with the introduction.
Yeah.
On a personal level, you know that my heart is in communities.
Yeah.
So that is the local is where it all happens. So that is a matter of that's a given. Within WHO, there's 3 levels. There's obviously HQ in Geneva, but we also work very strongly at the regional levels and at the country level. And this is that 3 level makes it incredibly important for us to be able to do the guidance work and so on through convening through HQ, making sure that we work at the regional level, because regions have their own priorities, their ways of working with their own priorities across the region. And then at the country as well, all the countries have kind of different priority levels. So we need to work across the 3 to ensure that translation happens. For I think critically now, and I think these are the new things that are part of the FP 2030 commitments, is that we have learned that we have to listen more. So as it is as important to go from the global to the local as it is from the local to the global. We need to listen and we need to learn what the actual problems are, how they happen. And this is, again, why the commitment and the partnership with FP 2030 is really important, because we talk to governments, they have a greater access to talk to communities, work much stronger with a whole range of partners within the FP30 group, the private sector and so on. And that is how that translation happens. It's a critical commitment for us.
I love it.
No,
I
absolutely.
feel you now on the ground.
And you mentioned, Professor Pascal, that you've learned you need to listen more. I'm curious, having heard the conversations over the last couple of days, what are some take-homes for you? And pretty much things will be in your in-tray by the time you get back to your offices in DC and Geneva. What will be top of mind for you from the conversations we've had here? I'll start with you, Dr. Samu, and then come to Professor Pascal.
Oh, thank you. And that is, again, it's a very important question, because after the whole buzz is down, what is it that you're going to do? I just want to commit for myself to work harder, that the country that hosts me right now, South Africa, makes a commitment. That's what I'm going to work hard on. The second thing that I want to work in my country of birth, Zimbabwe, should also make a commitment. I think it's important because where we come from actually matters in terms of where we are going to end as human beings. So that's what I'm going to commit to: convene more dialogues, collaborate with more people, and make sure in terms of where we are going, I will connect. I think so far I've got hundreds of business cards, so I will connect with everyone who does want to connect with me. Connect, collaborate, continue convening.
Fantastic, fantastic. Professor Pascal.
And I want to re-emphasize that our Director General, as you could see from the opening ceremony, has committed to sexual and reproductive health and rights. That is huge for that to be a strong commitment. And I guess so. The first thing, and I'll take more than one if it's okay, is for us to engage much more strongly with his commitment to universal health coverage and primary health care. Very often, sexual and reproductive health and rights and family planning get pushed to the end because they're the priorities of the pandemic and preparedness and so on. Commitment is to ensure that we get sexual and reproductive health and rights into the universal health coverage and primary health care programs. And the second is that, again, in the interest of listening, we have secured commitment for us to hold a CSO forum in Geneva with a focus on sexual and reproductive health and rights. So that is one of the things that we're going to push. And again, we've met a whole lot of people here that we're going to make sure that we have the opportunity to listen to. Last plug, if I may.
Yeah.
Sure.
Sexual and reproductive health, our program, HRP, is turning 50.
Oh, wow.
We want to listen to all of you about
Yeah.
how it is you want to celebrate with us the evidence that has been generated and that has pushed sexual and reproductive health over the last 50 years.
Dr.
Fantastic.
Dube, if we may, I won't let this go. Yesterday, in part of the commitments, those who attended, there was an all-inclusive look at tailored FP services to meet the needs of the LGBTI groups. As we're having this conversation going, how are you going to make sure that the tailored actually meet those needs?
Yes, you know, we always talk about solutions that are driven. They should be for us. It shouldn't be for us without us. So it's inclusivity, ensuring that the LGBTI community are at the center of what those services should look like. So in my team, we do have a team that works on advocacy and partnerships that actually convene such dialogue. So we will convene dialogue to make sure that as countries commit, they do include some of these services in their commitments. And as you know, we do have accountability frameworks so that they stay true to what they would have committed to for these particular communities. Our role is to ensure that that global dialogue is maintained and there is more that could be done from evidence that may come from WHO and others on what exactly should be included in those services and how they should be delivered. And then those communities, because they are the recipients of those services, they need to be part of that dialogue.
And just to juxtapose that with my guy, DJ Moss, who actually took it up, let's look at the male engagement. How are we bringing in the men and the boys to accelerate this conversation of protecting the girl and making sure we protect our wives and girlfriends in this agenda of the FP 2030?
Indeed, because social norms, social and gender norms, is one of the pillars that we need to work at if we are to increase access to family planning. I know that WHO has done lots of work around male engagement, male involvement, and this DJ, he personally took a statement to have a vasectomy done.
Amazing.
You know, so that, you know, he could do more. He said he took one for the family and we want to see more on that. There is also a high impact practice on male engagement. So we're seeing more and more men coming to the fore and tackling these social and gender norms that hinder women from accessing family planning.
And before we let you go, Professor Pascal, I have to get your thoughts on, and I know you're passionate about it, decolonization of global health. And we had a conversation earlier this morning about shifting power from a central place of funding, decision-making, and disseminating it, decentralizing it, I should say, to the locals, for them to have agency over how money is spent and where it goes. So how important is that, and how, in a practical sense, can that be achieved?
That is, again, as I say, critically important and is increasingly going to be evident in the way that we work, at the very least within my department in sexual and reproductive health, and probably across WHO. It is there is a greater emphasis now on making sure that there are proper country level and community level voices that shape not just the evidence, the way that we structure our research and drive the production of evidence, but then also in the policy implementation and practice at the community level. It's not just words. It is going to be seen very much in practice. We have to listen to this message.
Certainly, and we've seen that with FP 2030, moving from one central office to now 5 regional hubs. And how important is that in terms of the work that you're now doing, being more on the ground?
Yes, you know, there can be no global connectedness without shifting power. So for us, we've got managing directors who are going to be managing all those hubs, and they could engage. They are able now to be more nimble, to be agile, to engage with each of the countries where they work, and to also draw lessons from across countries to make sure there is that regional agenda. And I must say, even there, it makes it even easier for us with WHO to operationalize, you know, the commitment that they have made to FP 2030 because of these regional hubs. So it makes work easier, it makes the work credible, it makes us genuine because, as I say, we belong to these countries. And when we do work in there, it makes it more authentic. So that's why for me, this matters. We operationalize it by having teams in all these hubs, even though there is some, for economies of scale, there are some things that you need to still centralize so that you can move faster. But power ultimately lies in the hands of countries who love their citizens, and they can do more to see progress in many ways than one.
Wonderful.
Ladies and gentlemen,
you so
round of
much.
applause to the two global doctors here. The conversation can go on and on and on, but kid you not, this conversation and the commitments we have from the individuals to the institutions and to the countries, we're not having a conversation in Pattaya and we say that what happens in Pattaya stays in Pattaya. No. What happens in Pattaya, we have to take it home and we run it to the very last mile of our countries. And those who have committed, they live true to these words. Thank you so much. We'll be back shortly with another conversation.
Awesome, and welcome back. We continue with our critical conversations here on the FPNN stage, and we are continuing with our segment on the state of family planning, where we talk to different actors who are extremely crucial to extending those services to different populations. Yesterday, we talked to the faith-based groups and humanitarian groups. Today, we're talking to the private sector and the scientists. So let me welcome our two guests this morning, Linnea, who is speaking from the scientific community, and we also have Ashley from PATH speaking on behalf of private sector. Partnerships has been a big part of the conversations over the last couple of days. When you look at how different actors plug in to accelerating the efforts of different family planning players. Linnea, let me start with you from the scientific side of things. And we saw during COVID how the lack of trust in science really drew back a lot of the progress when it came to reaching populations. How important is it to have scientific minds on board, especially when we're talking about family planning agenda?
I think it's critical. I think the evidence that scientists can generate using rigorous methods, very much grounded in the community, thinking back to the comments of the previous speakers, that are really informed by the community. But I think it's really important and critical, in what the ICFP conference does so well, is not leaving it at the door. Scientists, we're very good at thinking, maybe less so at communicating.
That's a big maybe.
So having advocates, having media professionals, having program implementers, all part of this movement together, I think is what's really key, and hopefully will make this successful.
Absolutely.
If I could come to you, Ashley, the CSOs, they have been heavily in the world of advocacy again and again. When we have this conversation about the ICFP 2022 vis-a-vis the issuance we had along the way, do you see a shift in the advocacy? And if so, what kind of shift? And where do we go from here?
Yes, thank you for that question. Well, I'm representing the private sector subcommittee that's working as a coalition with advocates, governments, and private sector actors, as well as other implementers and scientists, to understand and support the role of the private sector in family planning. And when it comes to advocacy, we had a lot of conversations about that so far in the conference, about the role of the government when they can create an enabling environment that crowds in private sector actors and can help support universal health coverage of family planning. But the government also plays a role in protecting consumers with the policies and regulations needed to ensure that the consumers' rights are respected, that they have high quality access to services. So at this conference, we had the first ever private sector pre-conference for ICFP. And the focus was on an area where there's really been an explosion of growth in the last few years, and that's around digital solutions in the private sector. And COVID just accentuated this need so much for people to be able to access telemedicine and digital counseling, such as through chatbots, and e-commerce with pharmacies online being a place where you can access contraceptive products, self-care products, for instance, self-injectable contraception. And the governments are really trying to speed up to catch pace with the pace of introduction of these new solutions. So we've been discussing what policies are needed, what governments are doing to make sure that consumers are protected and have access through private solutions.
And how are you leveraging on the innovations, especially the digital footprint?
Yeah.
How are you leveraging on that to make sure that as a private sector, in terms of family planning, you still have everyone included there?
Yeah.
And especially those with impairments now.
It's tough. There's such a huge digital divide when it comes to gender, socioeconomic status. You were talking about disabilities as well. Lots of different ways in which people have unequal access to digital innovations. And so we're trying to identify what is working well and use public-private partnerships and investments to support what can close those gaps in equity of access, and use digital innovations too to best address the needs of those with disabilities who perhaps would like to access their products at home instead of going to a clinic, for instance. That
Nice.
there's a lot of creativity in this space, and it's a fairly fragmented space too, with a lot of innovation, and it can be hard for consumers, for the clients, for the people to navigate to where there are high quality services that will be reliable and accessible, where their data will be protected online as well. And so we've been discussing the role of government in helping people to navigate to what they can really trust in the private sector, in terms of the digital space and the physical space.
Thank you.
Linnea, let's talk about some of the gaps that exist when it comes to family planning research. We're starting to see a shift of more local research driving funding and whatnot. So kind of taking that focus away from maybe global donors to the locals. But how important is it to see that shift of research, for instance, to have a more local approach?
I think it's critical. I think it is important to have that global overview, the global idea of what is happening on the global scale. But change doesn't happen at the global scale. These are individual behaviors, and they're driven by the local context and the local availability of services, the local environment. And I think for a long time it has been a very external-driven. Researchers come in, they do their data collection, and they leave, and they don't have the understanding of what are the recommendations good? Are they based in reality at all, or is it just based on assumptions of what we think is correct? And I think it's been shown time and time again that those assumptions are often wrong. And it has to be informed by local communities. The research agenda has to be driven by local communities, and it should be a much more of a collaborative. If there's a role for the global north, it should be collaboration and support, and much less coming in, extracting that data and leaving, because it's not right and it doesn't work.
Certainly. Ashley, I have to come back to something that you mentioned, that this was the first time ICFP had a private sector forum. And I'm thinking we should have had this a long
10
time
years
ago,
ago.
right?
Yeah.
Why did it take so long? And how much of a game changer is that forum now moving forward?
Yeah, great question. Well, there have been presentations and discussions focused on the private sector for a long time, but I think there's also this growing recognition, not only of the innovations in the digital space and needing to keep up with those, but also in terms of the role of pharmacies, drug shops, and private clinics that can also be part of health insurance schemes, and they can be included in the movement toward universal health coverage. We're increasingly seeing the role that they can play and acknowledging the role they already do play in the marketplace, a role that we don't get much data from the private sector about service delivery. So we sometimes ignore it. We focus so much on the public sector, which is also extremely important. But as we're task sharing more and more contraceptive method provision with pharmacists and drug shops, we're looking for ways to ensure that we are assuring that quality, that we are getting data from them, but also supporting them to be a part of the thriving marketplace and health system for contraception.
You say that the space is a little bit more fragmented.
Yeah.
And it's the same happens to the data.
Mm-hmm.
I'm a private player. She's a private player. We all have data fragmented.
Yeah.
What are you planning to bring this data in one pool that we don't have double counting of some of the statistics we are having if we're going to actualize the FP agenda?
That's a great question. There's been a movement to have national health information systems include the private sector data, which means working with those in the private sector to train them on the forms that they need to fill out, the electronic submission of data, and then have that data considered in the data review meetings that the ministries of health have with their partners to look at what's happening, where the gaps lie, and it's about health service delivery data and also logistics data when they're included in the source, when the supply that can often flow through the Ministry of Health, the supply of the products makes it to the private sector as well. We need to understand if there are stockouts, if there's a need for additional product, where that product is needed and how we can fill the gap.
Certainly. And I think as we close out, just want to get both of your thoughts in terms of take homes, maybe from the scientific approach, in terms of what more can be done to solidify collaboration between the different arms within family planning, and just to make those partnerships effective for the people who need it. So from a scientific perspective, what more could be done?
That's well, I think having these opportunities to really bring together minds from all over, from across the world, and not just across the world, but across disciplines. So there are people here who are economists, demographers, qualitative researchers, people who bring very different views and expertise. And I think having these kinds of convenings is really useful. And I think really investing in the local universities and education systems and training scientists from the ground up is what's going to be increasingly key and is already shifting. And I think that is a huge need. And I think we're getting there. And I think that's hopefully where the answer is for really building these local collaborations that are effective.
Wonderful.
Takeaways? I think it's really, for me, the presentations have highlighted how diverse the private sector is, from manufacturers to wholesalers, social marketers, the pharmacies and drug shops, the digital solutions, and many others too. And that partnership is absolutely needed. Collaboration is needed between those working in the public sector and the private sector, all of the actors in this space, in order to advance toward universal health coverage. It's going to take everyone, and to make sure that we respect and fulfill rights along the way. So we're in it together. We're collaborating and learning from one another.
Fantastic. Thank you so much.
There you have it. Let's give them a clap to those who are here. And those who are watching us from around the globe, we want to thank you so much. And if you're from the private sector, Ashley here represented you. Great, the scientists. And Anna actually did a great job there. This conversation won't stop now. We actually have more of this conversation. So Victoria and I will actually come back tomorrow about the same conversations. The conference is still ongoing. There are a couple of conferences and different breakaway sessions that are still amplifying these conversations. But not only that, there are a couple of things we should look out for in this conference, Vicky.
That's right. And of course, we want to release Lene and Ashley so they can take their seats off the stage, and we'll head back to our desk. But we'll give you a few more updates on what to expect in the coming days here at ICFP. Thank you so much, ladies. Appreciate your time and your insights as well. Thank you so much.